The Asian Pacific American Network of Oregon asks, what's your healthcare story? APANO asked a group of Asian and Pacific Islander community members.
My name is Jennifer.
My name is David.
My name is Anselmo.
I'm Andrea. My name is Madeleine.
Questions about their unique and diverse experiences in accessing healthcare to better understand what works and what doesn't work to keep our communities healthy. APANO asks, has language affected access to healthcare for you and your family?
I think language barrier for me, I just remember at 10 years old coming to the United States for the first time and not understanding English and going to the doctor's office and times when mom couldn't be there when she's working, or someone else took me when she couldn't be there to translate for me, how terrifying that was to have these strange white people poking things at me, and I think I had some weird ear infection or something like that, and they were flushing, I just remember this so clearly, they were flushing my ear out with water, and it was really painful, and I was just screaming on the doctor's table because I just did not know what was going on. And it was a strange experience having people who were speaking a very foreign language touching me very intimately and trying to help and trying really genuinely to communicate with me and not understanding. So I think that was a pretty formative experience in terms of language barriers, and not having anyone there to translate for me was pretty difficult.
I think the fact that people knew my dad was a physician, they would kind of treat me and my family differently because they knew that we knew, or I didn't know, but my parents knew kind of the terminology and more background, so I think they'd be more willing to be honest and not kind of beat around the bush for certain health issues. So in that sense, I think I didn't really experience language barriers, but in my dad's, the hospital he worked at, there was a lot of Latina patients that would come in, and so he tried to learn Spanish, but it didn't really, it wasn't his first language, and so a lot of times he had to bring in a Latina nurse to come and help translate. And so I think, the translation, sometimes things get lost. And so I think it was difficult for some of the patients that he had because they felt that they couldn't express or ask the same questions that they really wanted to. So
I would have to say for language barriers, it was my dad who has the one that he understands English, but he cannot express what he's trying to say in English. So, my mom has a nursing background, so he would always speak to her, tell her what's going on with him, and then she would tell him what he needs to do, and then tell him he also needs to go see a doctor. And whenever he would go see a doctor, one of us kids would go with him after school because our mom would be working or she'd be at school, and we would have to kind of translate with the doctor or the nurse who was coming in to do the prep work, Dad, this is what you have to do, and he'd be why? I don't want to do that, We're no, just listen, you'll have to get blood taken out, or you just need to answer the questions that they're asking you the best you can. If something hurts, let us know. So he would just he got used to us being his interpreter, but then now I don't know how it is because he's back in the islands, and I have to say it's really hard for me now because I just got wind that my dad got hurt recently, and there's nothing I can do because he's not here in the States, and over there the health system is not very good. So when I heard that he got hurt by a machete knife, I was scared to death. I was oh my God, what happened? No one was there for him when he was in the plantation just doing his tarot. if he was here in the States, then that'd be a different story. Like, we could get him immediately to the hospital, get him taken care of, and then let him know, like, you cannot do this stuff. Like, you need to just, you know, be active in other ways. But just the language barrier is still there, and I don't know. It's just a cultural thing and family experiences. But yeah.
Looking back on it, in my family, my family now, Rosemary and Martin, they have a good command of English language, so we don't have that issue. But in the work I've done in the community over these years, I've had my fair share of witnessing what's called the language barrier. And what's interesting to me, we always say, well, it's the patient who has the barrier. I don't believe that. It's the institution, the doctor's office or the hospital. They're the ones that have the barrier. The patient is there to get some service, and they don't know how to, the system doesn't know how to work with them. What I'm seeing, because I always have my radar out for that kind of a thing. I mentioned about my son's situation, and when we check in, they have this fairly large poster just mounted on the front desk where you check in. It's probably at least half as big as this table, and it has probably 40 different languages on this poster board, and it has the name of the language in English, but the name of that language in that language, and it has directions written in that language. And basically it says, if you need help in any of these languages, point to the language and show the receptionist, and they have some kind of a hotline that they dial up, and there's instant access to an interpreter in those languages. And I go, wow, that is really cool. And I wish other medical facilities, every single medical facility would have that. Every bank, every other public service. But I've only seen it at this one department over at the New Peace Health Hospital, not in every department, just this one. And so the question in the back of my mind, like I said earlier, how come this isn't just standard operational procedure in all of the public services? And, so I think that's pretty cool.
Mm-hmm. Yeah. My mom is actually a certified translator.
Oh, okay.
So she translates English and Chinese, and she does like live translation in meetings and things like that as like a side job. And then she also volunteers her time with, I think there's like a Asian American domestic violence organization in Sacramento, and so she does translations on the phone for them so they can call her up during times that she designate is okay, and she'll translate for the person experiencing domestic violence on the phone and then translating it to the services. And the funny thing is, although that there is like a language translation, that sometimes she would go above and beyond and actually offer her phone number to the survivor of domestic violence and say, call me up if you need anything, because it's not just the domestic violence they're struggling with, but they're also struggling with a lot of other things, and language barrier can be huge. And so then it becomes an issue of personal boundaries, because then these women, most of the time women, will call her up for a lot of other things, and she's willing to help them, but I think that there's a need for more than just translation. That these women, not only are they receiving that translation from her, but obviously they also need a lot of other things from her, and she's doing this on her own time. But I was just wishing that there's more that we could do in terms of these special services and just otherwise healthcare in general, of providing them with what they need, instead of my mother volunteering her time. I mean, she's only one woman, she can't serve everyone.
What does it take for the system to understand these pieces? And we're as communities of color, as APIs, we're at the mercy of the system, and it should be the other way around. It's like we're serving the system. Your mom, what's her first name? Cindy, Rosemary, they're serving the system. It should be the other way around. The system should be serving them.
Yeah.
And what's the going rate for interpreters? For translation, I know it's like almost $100 a page. But my wife is always translating for free because she knows it won't get done. That's what I'm talking about. So she's home at night, bringing things home, translating for other teachers. Every once in a while, though, there's a happy ending to all of that. There was a case, a family from China here in Eugene. I was living and working in Hawaii at the time, and I had a good friend up in Seattle. The woman in Seattle knew this family, and they were not getting the services that they needed from the local medical community because they felt that for their son, it was like a mismatch. The treatment wasn't, maybe 20% of the treatment was working, but still the majority of it was not. So they called the woman in Seattle and said, look, what do we do? And she would say, well, I know a guy who probably could help you out. That was me. And here I am in Honolulu. This is all via email. So I still don't know what the medical situation was, but I kind of cast the net via email fairly wide between here and Seattle to my connections. Lo and behold, there was, due to those connections, someone up at OHSU, up in Portland, the hospital up there, who, and this probably took maybe about a month. It was just phenomenal. Ended up that this young boy got the treatment he needed that was culturally appropriate and the language needed, and they're happy campers. That experience, here I am 3,000 miles away from Eugene, and my friend in Seattle's, 5 hours. If we can figure it out, why can't the local community figure that out? As a society, as a community, we have a ways to go around all of this, but because there are people like this guy Anselmo, whoever, who has these networks, my friend in Seattle, it just points to me that it can be done. It's not rocket science. It's just a matter of connecting to the community, finding out who's out there, and using the resources at hand to make those connections happen. And I don't see, for me personally, the medical community, in this case for this morning, stepping up to that. It's always the community, kind of on the backs of the community, finding those services, like your mom, Gennie. At some point in time, when's that going to be reversed? Where, your mom, my wife Rosemary, can take a little bit of a break, but I do know that it's always going to be there, and that's what's hard about it, is that when is it going to happen?